Have you ever gotten a medical report back and just stared at it, feeling like you needed a secret decoder ring to figure it out? Well, today we're tackling one of the big ones, your mammogram report. We're going to break down all the numbers, all the jargon, so you can walk away from this feeling way more confident and in control. Let's dive in. Right? It's a totally common feeling. But here's the thing, what if I told you there's actually a universal translator for this stuff? A system that was specifically designed to make sure a doctor in New York and a doctor in California are speaking the exact same language about what they see. Well, that system exists, and it's called BIARS. That stands for the Breast Imaging Reporting and Data System. And honestly, it's the key that unlocks what your report is really trying to tell you. So here's our game plan. We'll look at why this system was created in the first place, then we'll walk through the different scores you might see. We'll cover what happens when a follow-up is needed, decode some of that radiologist lingo, and then wrap it all up with the key takeaways. Okay, first things first, why even bother creating a whole system like BI RADS? Well, the reason is actually super simple, and it's all about keeping you safe. This quote really says it all. The whole point was to get rid of any confusion. See, before BI RADS, doctors might use really vague descriptions like breast nodules. What does that even mean? Now, thanks to this system, a radiologist can send a report to a surgeon across the country and there is zero ambiguity. They both know exactly what's being discussed. It's all about clarity. All right, let's get into the part you're probably most curious about. What happens after you get that routine screening mammogram? Let's walk through the most common results. The whole process is pretty straightforward, really. You get your screening done, the radiologist takes a close look and gives it a B RADS score, and then that number tells you exactly what happens next. Simple as that. Let's start with the absolute best news you can get, a BI RADS score of 1. This means your mammogram is negative, totally normal. The radiologist didn't see anything worth mentioning. This is the big, beautiful all clear. Next up, BI RADS 2. This is also considered an all clear, which is fantastic news. Now, it means the radiologist did see something, but whatever it is, it's definitively benign, completely non-cancerous. We're talking about things like simple cysts or harmless calcifications. So, nothing to worry about. You just come back for your next routine screening. Now, getting a B RADS 0 score can feel pretty scary, but I really want you to hear this. It just means incomplete. It is not a diagnosis. It could be that there's a spot that needs a closer look, or it could be something as simple as a blurry image. All it means is that you'll be called back for some more detailed pictures, like an ultrasound. It's about gathering more information. Okay, let's move into the B RADS categories that mean, yes, a follow-up of some kind is definitely needed. We're talking about categories 3, 4, 5, and 6. So a B RADS 3 score means the finding is probably benign. And look at this chart. It shows you just how probable that is. The chance of a B RADS 3 finding actually being cancer is less than 2%. So we're talking about a 98% or higher chance that it's nothing to worry about. Radiologists are actually really careful about when they use this category. It's usually for a first-time mammogram where they see something that has all the classic features of being harmless, like a mass that looks like a fibroadenoma, which is just a common benign tumor. Because the risk is so low, they don't jump to a biopsy. Instead, the plan is to just keep an eye on it with a follow-up in 6 months, and then every so often for about 2 years, just to make sure nothing changes. Okay, this slide is really important because it breaks down the difference between the next two categories. For both B RADS 4 and 5, a biopsy is going to be recommended, but the level of concern is totally different. A B RADS 4 is labeled suspicious. You'll see the chance of cancer has a huge range, from 2 to 95%. It's kind of a catch-all. If the biopsy comes back benign, everyone feels pretty confident with that answer. But a B RADS 5, that's highly suggestive of malignancy. We're talking over a 95% chance. The radiologist is so sure, in fact, that if a biopsy for a B RADS 5 finding somehow came back benign, they'd actually be surprised. They'd likely recommend a second biopsy just to be absolutely certain. And last but not least, B RADS 6. Now this one is different from all the others. It's only used after a cancer diagnosis has already been made and confirmed with a biopsy. So this category is for monitoring a known cancer, maybe to see how well it's shrinking in response to chemotherapy before surgery. So, we've covered the numbers, but the report isn't just a score, right? It's also full of descriptive words. Let's pull back the curtain on the language radiologists use to describe what they're seeing.
When a radiologist finds a mass, they basically become a detective, describing 3 key features. First, the shape. Is it nice and round, or is it an irregular shape? Second, the margin, which is just a fancy word for its border. Is it smooth and well-defined, or is it spaky and fuzzy? And third, its density. How does it look compared to the normal breast tissue around it? And here's a really fascinating piece of insider info. Of all those things they look at, shape, density, you name it, experts say the margin, that border, is the single most reliable clue for telling if something is benign or malignant. A nice, smooth border is generally a really good sign. A spiky or spiculated border, on the other hand, is more concerning because it can suggest it's invading the tissue around it.
Wow. Okay, we have covered a ton of ground. So let's pull all of this together into a simple summary of what you really need to remember. Think of this table as your ultimate cheat sheet. Let's just run through it one last time. 0 means incomplete, you need more pictures. 1 and 2 are your all clear, just stick to your routine screening. 3 is probably benign, you'll do some short-term follow-up. 4 and 5 are suspicious, and a biopsy is the next step. And 6 is for monitoring a cancer that's already been found. Look, the whole point of this system and the whole point of this explainer is to take away the confusion and give you clarity. Because being an informed, active participant in your own health journey is one of the most powerful things you can do. So now that you speak the language, what's one question you feel ready to ask at your next